اليوم رح خبركن شو عمل بوجهي لحتى صار هيك وكيف رديته رجع على طبيعته. للتذكير أنا جوزيف وأنتوا على SkinFits، قناة نحكي فيها عن عناية البشرة والعناية بالنفس، فأكيد اشتركوا بالقناة وبسوا على الجرس تعرفوا عن كل فيديو جديد أول ما ينزل. يلي متابعني على الانستغرام بيعرف انه الشهر الماضي انا كنت مسافر على لندن، وخلال زيارتي حبيت اشوف دكتورة كتير بحبها على السوشيال ميديا وهي دكتورة سارة تونكس، ويلي متابعني صار له زمان بيعرف انه انا كتير بحبها الدكتورة وكتير بتابعها ومتعلم منها كتير عن التجميل على اليوتيوب، حتى انه بعثت لها صورتي قبل لحتى تنتقد لي وجهي وشو بدي زبط بوجهي، فحبيت هالمرة اشوفها شخصيا ونعمل شيء كتير بسيط لانه مسافر وهو أبر لحتى رطب البشرة من جوا. بالفترة الأخيرة عم جرب أخسر الوزن يلي تراكم علي بوقت الحجر، تقريبا أكتر من 10 كيلو، فيلي صار معي لما خسرت هالوزن بسرعة وجهي بين عليه تعبان، بين عليه أنه تغير شكله، فلهالسبب حبيت أعمل مع الدكتورة أي شيء بحفز الكولاجين، أي شيء بشد الوجه شوي لأنه بدي يرجع شكله مشدود وما يكون بين تعبان كل الوقت، مع أني ماني تعبان. قررنا نعمل أوبر هيالورونيك أسيد لترطيب البشرة وتحفيز الكولاجين من دون ما ننفخ الوجه، فعملنا الوجه كله ومنطقة حول العيون. بس حتشوفوا هلا أنه العوارض تبع استخدام أوبر لترطيب البشرة أنه بنفخ الوجه أول ما نستخدمهم بيرجع الوجه بخف بعد فترة، فلهذا السبب وجهي تحول لهالمنظر. حفرجيكم هلا كيف بلش وكيف صار وجهي مع الوقت. أول شي عنا الصورة قبل ما زور الدكتورة، مثل ما شايفين وجهي كله متوحد لونه، ما في انتفاخ، بس تحت العيون بتشوفوا انه في شوية تعب يلي انا بهمني انه خفف هيدا التعب. شكلي اول ما طلعت من عند الدكتورة وجهي كله منفخ، تحت عيوني كتير منفخ، طبعا هيدا الشي مؤقت، حتخبركم الدكتورة بعد شوي ليش بصير هيدا الشي وليه بده شوية وقت لحتى يروح. هلا بتشوفوا كمان خدودي مش كتير ناعمين، بتحسوا كأنه محفرين، فهيدا كمان كله بيروح مع الوقت. شايفين الكدمة بالخد؟ هذا لأنه عم نحقن بطريقة سطحية، وهيدا الشيء معقول يزيد من احتمال أنه يصير في كدمات بالوجه. قد بضل الانتفاخ بيختلف بين الشخص والتاني، أنا بعد 3-4 أيام خفت 80%، بعد 5 أيام بتشوفوا انه الوجه كله صار شكله مرتاح، بس بعد في شوية انتفاخ، فيوم بعد يوم صرت تحس انه عم يرجع وجهي لطبيعته. فهيدا الشيء بيختلف بين شخص والتاني. الشيء الوحيد ضل واضح عندي هو الكدمة على وجهي، فيكم تشوفوها. فيلي عملته انه اشتريت كريم لحتى يساعد انه هيدا الشيء يروح بطريقة اسرع، اسمه هيرودويد اخذته من صيدلية. هيدا بيساعد انه يتخلص من الكدمات اسرع. وهيدا وجهي هلا رجع على طبيعته مثل ما شايفين، ما في انتفاخ. لقيت فرق كبير بشكل التعب على الوجه، يعني لما كنت مسافر وتعبان طلع بالمراية وما لاقي تعب بعيوني، حبيت هذا الشيء. حتى اليوم انا عم صور وتعبان بس ما حس انه تحت عيوني شكلهم تعبانين، فهيدا اكتر شيء فرق لقيته بترطيب البشرة. حسيت انه بشرتي فيها ترطيب زيادة، منا هيك قشطة، فحبيت نتيجة هيدي الجلسة. لباقي هيدا الفيديو رح تخبركم دكتورة سارة تونكس شو هي العلاجات اللي بالتحديد اللي عملناها هلا وجهي ولا منطقة تحت العيون لحتى تعرفوا شو هن بالتحديد، وكمان رح تخبركم عن علاجات تانية شبيهة لها وكيف تختلف عنها. لازم تعرفوا شغلتين، اول شي وجهي كان منفخ بالفيديو لانه صورنا دغري بعد العلاج، وكمان الفيديو بالانجلش، فيلي بفضل حيكون في تحت الفيديو مكتوب بالعربي ترجمة شو عم نحكي.
Today we are with Dr. Sarah Tonks, who is a practitioner in London, and she's going to talk about what she did to my face. Thank you for having me, Dr. Sarah.
Thank you for coming.
Dr. Sarah Tonks, tell us about what you do, your background, so people know also where to find you.
Sure. So I work in Chelsea in London. As you say, I'm a doctor, but I also have a degree in dentistry as well. And I've been doing aesthetics for a long time now. I think I started back in 2007, so it's been a while.
Yeah.
I think one thing that's really interesting that maybe we could talk about is how these injectable moisturizer type treatments have changed so much over the years. In more recent years, there have been a ton of new, quite innovative products coming out, and one of the ones that we used on yourself is one called Belotero Revive. So it is cross-linked hyaluronic acid from a brand called Belotero. This one I particularly like because it does give you a really good glow. It's been shown to improve luminosity for up to about 9 months, which is really cool. Now I'm just using a 30 gauge needle to pop the Revive into the skin. You can see it's pretty normal to raise a bit of a bump when you're having the Revive. That goes quite quickly. Oh, bit of a bruise there.
So this we used all over the face. That's why you have a little bit of, is it swollen still, or?
Yeah, a little bit of swelling. So we use 1 ml per side, and of course there's a little bit of bruising as well, which is normal. And for that product you're supposed to do 3 treatments, which are approximately 1 month apart.
Okay.
But you will see an improvement just with one.
So I've had Profihlo before. How does that compare to Profihlo?
Profihlo is not cross-linked at all. So if you imagine, most of these products are made of hyaluronic acid, which is a long-chain sugar molecule. With some of them,
we have naturally in our skin.
in a product like this, the hyaluronic acid is not cross-linked. Instead, it has positive and negative charges on it. So imagine it's a bit like a bowl of spaghetti. So the bits are sort of loosely associated with each other, whereas with this one, with the Belotero Revive, you do have some cross-links in there. So that means this one will hang around in the skin for a bit longer.
Okay.
Whereas this one is actually gone quite quick. Is that relevant? Does it matter? It's a good question, actually, because when you use a product like this, you're relying on the hyaluronic acid activating certain receptors on the fibroblast, which then makes you produce more collagen. So does it matter that it doesn't stay in the skin for very long? This is the whole principle behind mesotherapy. So when people have kind of the older type of mesotherapy sort of treatments, which just inject hyaluronic acid maybe with vitamin C or something else like this, that's what they're relying on, this activation of the fibroblast.
So the one we did today, actually, it does work on the receptors, but also gives a bit of the glow, as you describe it.
Yeah.
And the glow is because of the hyaluronic acid is giving that glow?
Yes, but this product also contains glycerol as well,
Okay.
which is a mild antioxidant, and it also helps hold a bit more water into the skin as well. And now we're going to go with the TEOSYAL REDENSITY 1, which I'm going to use a cannula. So we just make one entry point lateral to the eye that we can pop the cannula into, and we just sort of paint it underneath the skin there. It's really normal to have some swelling underneath the eye once you've done this treatment. In a younger person, typically that will go away quite quickly. But if you're a little bit older, it can be up to a couple of weeks if the skin is particularly crepey. But that is TEOSYAL REDENSITY 1. So that one is uncross-linked hyaluronic acid, amino acids, and some different vitamins and minerals in there as well. Instead of placing it deep on the bone, you place it much more superficially, so just underneath the superficial layers of the skin, and you kind of paint it underneath with a cannula.
So sometimes when you place filler a bit too high, it does a bit of a blue color, or this one you wouldn't have that problem.
No, because it's uncross-linked. So the idea behind it is not to fill the area, it's literally just for skin quality improvement.
We're not filling the face, we're hydrating. So
Exactly.
all we did today was inject the face with kind of like a moisturizer within the skin, so that it's plumping from within without actually adding volume.
I wanted to show you the cousin to Profihlo, which maybe you're not familiar with. So they're from the same brand. So it's this company called IBSA. So this one is good for kind of general skin improvement and hydration. This one, the Hydrobooster, is very good for dynamic fine lines. So you know, if you have small fine lines in the upper lip or fine lines in the crow's feet, for example, that's caused by muscle movement. So you moving that muscle is causing the line to be there. This one is very good for that. Let me tell you the difference. So with the Profihlo, if you inject it into a fine line, it doesn't stay in the line, so you inject it in and it kind of just squidges out to each side, and you know, you get a little bit of hydration and some collagen production, but it doesn't treat the line itself. This one, you put it in the fine line and it doesn't move. It stays where you put it. That's the whole point of it. But this is, in my opinion, one of the best ones for dynamic lines.
And I think a lot of it is finding the right practitioner that tells you what you need versus just... Because I came to Dr. Sarah, I said I want Profihlo, because I love Profihlo from before, but you suggested other things that work better for, after seeing me especially.
And I said, let's just try it. You know, you've done Profihlo before, you know the effects from that. Try this to see if you notice any difference. Sometimes you'll have a product which is for skin improvement, but is not hyaluronic acid. You know, they call it in Korea, in the Far East, salmon sperm. Yeah, because it's made from
salmon sperm.
yeah, but works really well, works a treat. So it's polynucleotides, it's not hyaluronic acid, and it acts on a different receptor on the fibroblast, which is the cell that produces collagen. So you're going to have a different result if you act on a different receptor. So a lot of my patients, they'll combine it, so maybe they'll do Profihlo, or maybe they'll do Revive, and then they'll switch and maybe do Nucleofill instead. And you do a total of 4 treatments, which are about 2 weeks apart.
So you heard it here, Koreans use salmon sperm.
This is another type of product. So we've got Sculptra, which you've probably heard of, and Lanluma. This is Lanluma V. Now they're both polylactic acid, so they're made of the same active ingredient. And mostly these are used for revolumizing the face. If you do what I would call a wash with the product, so that you hyper dilute it and you sort of inject it all over the face, it just makes your skin look very even, very glowy. It's really great for people who have got acne scarring, because you can introduce it with a cannula. So if you put the cannula underneath the skin, you sort of fan it around like this, and you can break up a bit of the acne scarring with it too at the same time. And this one's for the face. The body one's much bigger, and that is the same one that you would use for a non-surgical butt lift.
Okay.
As well, should you wish to have a non-surgical butt lift, but you can do it here, you can do it on the abdomen, you can do it on the thighs, anywhere where you want to see skin quality improvement. So it's not hyaluronic acid, it's polylactic acid.
So would you ever do a combination in one treatment of different stuff, or you would just basically space them out, or different areas, different type of things?
So I would say I would maybe not in the same area do 2 at the same time. I think most patients, if you're treating the same area, would do this one first, because it will give you kind of a more global improvement over the whole face or body part or whatever it is, and then you go back and do the fine detailing using hyaluronic acid.
Okay, so you have all of these in your clinic, and you would decide based on the person, or based on, is it different price points? How would you decide what to go with?
So it's a good question. It depends on quite a lot of factors. So can they come back? Because if you can't come back, we need to pick something that you only need to do once. So that's the first thing. The second thing is, are they happy to use a non-hyaluronic acid product? Maybe talk to the patient about perhaps alternating them, or maybe even just going with one of the hyaluronic acid products on its own. Depends what the person wants. And then the last thing is about the area that we're treating. So different products will work differently on different parts of the face. For example, I never use Profihlo in the forehead. I just don't think it does anything. It doesn't work. But its cousin treatment, the Hydrobooster, will work really well there. So there's a lot of factors at play. So that's why it's much better, I think, to have a consultation rather than going in and saying, you know, I definitely want to have Profihlo, which does happen sometimes because a lot of people have heard about Profihlo.
I think a good way for people to get into injectables without doing the filler that usually changes and adds volume. I wish I had started with this first, so I understood better how my face deals with injectables. So I think it's really interesting, and I can't wait to see how it looks once it comes down.
You know, a lot of people do use this as an entry point as well into doing injectable treatments, because they're a bit worried maybe about looking different, whereas you know that with something like this, it's not going to make you look different, it's just going to give you skin quality improvement. I do think the irony somewhat is that often there is more downtime with a treatment like this than there might be with, say, a nasolabial fold injection or a cheek injection that you may not notice, whereas the swelling for this can sometimes be quite pronounced for a few days afterwards.
Yeah. Alright, so that was all the information for today. Thank you so much. I learned so much with you, and I can't wait to see how my face turns out after it settles down. Definitely, if people want to get in touch with you, they can do so through your website or your channel, because you are on YouTube as well. And there's a lot of information. I learned so much from your channel, and it's really a lot of good info that everybody should know.
And I'll try and jump in the comment section as well for the video if anybody has any pressing questions.
Thank you.
Thank you.
بتمنى تكونوا انبسطتوا بهيدا الفيديو. إذا حبيتوه بسوا على اللايك، وإذا عندكم أي سؤال حطوه تحت الفيديو. نشوفكم بالحلقة الجاية. باي باي.
Ladies and gentlemen.